Dentistry is widely regarded as one of the best professions in the United States. But I know a lot of dentists who would not agree with that. Now, they might have if they had been asked 5 or 10 or 15 years ago, but not today. Something has changed in the practice of dentistry, and it's not a change for the better. If you don't look forward to going to work, stay tuned. I'll be back after the break to tell you how to get back to doing more of what you love instead of what you have to do. I'm Colin, Receiver, CEO of SmartBox. Thanks for watching the Patient Attraction Podcast. Now, I know a lot of dentists, and overall, I would say they're a very happy group. But I also know too many who are seriously thinking about selling their practices and leaving the profession. When I talk to those unhappy dentists, I find they have a few things in common. Now, one is that they're not handling enough of the cases that they love to do. Now, practically every dentist has some type of case that really gets their motor running. Maybe it's Invisalign, maybe it's implants, maybe it's cosmetics, maybe it's root canals. Now, enough of those cases will make up for a lot of routine exams and filling replacements. Another thing those dentists have in common is that they're working more hours and days than they want to. Now, that includes dentists who have been in practice for years and who are looking at retirement. Maybe they're tired of the 5 and 6 day weeks. I can't say I blame them. That's a lot of time spent hunched over open mouths and doing unrewarding work. Most of those dentists need their time to just recover and try to prepare for the next week. And many of them can't manage more than 1 week of vacation a year. Now, that's not what they had in mind when they got into dentistry. The two things that unhappy dentists have in common actually have one thing in common. They're not getting enough of the right kinds of patients. Now, what they are getting is an unending stream of low-value, price-driven, insurance-driven patients with no loyalty to their practice. And they're doing unrewarding work for too long with not enough in return. But if you think about it, it's really not surprising because those prospects are who they're marketing to. Now, when I say that, most unhappy dentists deny that it's true. But after a few minutes of analyzing their marketing, they change their tune. And they ask me, well, what else should I do? Well, let me say this. There's an old saying that if you want something other than what you've always gotten, you have to do something different than what you've been doing. Those dentists have been chasing those dental patients by advertising low prices and specials and discounts for years. They've done nothing to differentiate themselves from all the other dentists who advertise just like they do. They've ignored the 20% of every market that has the resources and has the willingness to pay more for the right dentist. They're getting what they ask for, but not what they want. Now, these unhappy dentists won't get that 20% of the better patients because they're a low-price leader. The motivations for that group are very different. They're interested in finding the right dentist, someone they know, like, and trust, that can be the dental expert for them and solve their problems. Now, if you're among that group of unhappy dentists, start with your marketing. What are you doing to stand out amongst the masses of dentists in your area? In today's competitive dental industry, if you're not standing out, you're in the masses. Nobody's looking at you. People assume, your patients assume in today's world, that all dentists are competent. If you want better patients to choose you, you have to give them reasons to think of you as something other than just a dentist, right? You can't be a commodity. What I've described is the foundation of our patient attraction system. It's the same system we're using in practically every market area in every state here in the country. Now, I'm happy to say that those dentists, almost without exception, are finding the joy in the dentistry that they may have lost. Now, if you're ready to do something different to get those different results, start here. Get started today at patientattractionblueprint.com. Schedule this call, take the first step, listen to what we have to say about how we can help you double or even triple your practice. And in the process, find what you've lost. Find what you love. Join me for our next podcast. Until then, keep moving forward.